out of the conversation tonight, was there a salient point or an aha moment that you hadn't thought of that kind of made you look at all this a little bit differently?
Well, I have to just say, knowing Kimberly has been for me a very special, very special. And I would like to ask Kimberly, when she has, when I think of you, both of you, with, I don't know who's got the...
You're so funny to think, what's worse, breast cancer or brain cancer? Well, we both have.
No, I was asking.
They both suck at
I was asking Kimberly. Look, I don't know. Thank God anything about. Thank God. But how does her situation compare to Elizabeth Edwards? And you said you had. Or why don't you?
I have a non-hormone based breast cancer with a metastasis to the brain. But they were never able to prove that it was a metastasis because they didn't biopsy the brain tumor. They gamma knifed it out. Elizabeth Edwards has hormone-based breast cancer that metastasized to the brain, which they were able to biopsy because it was right there. So there's so many.
Which they think may be related. You're a social worker. You said your social workers would explain to you.
Well, right, that it could be related to the fact that she did take fertility drugs having her last child. And this is where the hormone-based breast cancer is different than mine, where I never had children and I didn't go through menopause, so my breast cancer was just hormone-based. So the chances of it coming back are purely based on genetics, like you said. And my poor mom is here. I don't want to, another thing to blame on my mother.
But it's HER2 positive.
But it's HER2 positive, exactly. So what was the question?
Well, the question is, as you go through your treatments, you meet a lot of patients who are not and again, one of the things that I think is so terrific is you're very open about who you are and your family and so forth. All these patients who are really in big financial trouble. I mean, just tell us if you can what that's.
Well, I mean, I think for me,
you said you were in the treatment area yesterday, and you hear these.
Well, I'm seeing everyone from people who are going for their first chemotherapy treatment to people who are in the middle, to people like myself who are coming back for maintenance. Every month I go in, and I think there's a thing called survivor guilt, and going through something with stage 4 and living through this. A lot of people that I met through certain support groups or online have passed away in the 3 years that I was diagnosed with the same prognosis, which is an awful word, and you doctors should never use it. I don't know if you do, but not to your patient. Which is when you're told you have 5 years or 3 years or 2 years, and you live beyond that, you start to feel obviously wonderful, but at the same time you're going back and you're seeing other people, and you carry a survivor guilt with you a little bit. The work that I do in Haiti, I think, is something that, when I was going through my chemotherapy, that really brought me through it, because before I got sick, I was working in Haiti and seeing people who are dying of diarrhea, dying of not knowing that they needed to wash their hands going from here to here, and now their children are dying, and this is a disease, or diarrhea is not a disease. I mean, this is something that's curable, treatable, And I remember a few years before I was diagnosed with breast cancer, I was walking through a clinic, and there were about 60 women lined up at the women's clinic to get an exam. And I think my mother was with me on this trip. And we were walking through, and it was my first time. It was actually Dr. Paul Farmer's clinic. It was my first time seeing his hospital. And there was a woman there who looked in her 30s, who had her breast out, and literally it was like the size of a grapefruit. It was enormous. And I was trying not to look at it, but I was just really taken aback. And when we walked past, I said to the doctor that we were with, I said, what was that? And he said, well, it's obviously a tumor. And I said, well, what do you mean it's a tumor? He said, well, it's breast cancer. I said, well, what's going to happen to her? And he said, well, we'll take her in, we'll cut it off. And I said, you're going to cut off her breast? And he said, well, yeah, we'll cut it off. And then I said, well, does she get treatment? And he said, no, she's going to die. We'll cut it off and she'll die. In a year, she'll die. There's no chemotherapy, and I thought about that the whole time I was going through, and I had so many complications, and I went through hell, but I thought about, I'm going through hell, but I have all of these options here, even though we're complaining about what we had. Here was a woman sitting there, and she didn't even know what was happening. She came in, And maybe if there was something, you know, where she could have gone to see a doctor earlier when the lump was small, or, I mean, who knows? But that is something that really carried me through when I thought about how lucky, I don't know if that's the right word, but fortunate that I was to be able to have treatment, and then still now, being 3 years into this, going back to that country and trying to help their system, their healthcare system, and here.